Welcome to F.M.C. Keffi, Nigeria's most electronically advanced healthcare facility. To access care in F.M.C. Keffi, all a patient needs to do is to walk into the Health Information Management Unit, popularly called the Records Unit. The patient hands over her card to the records officer, who logs into the system, searches with the person's PID, finds the person's details, and then sends to any clinic the person wishes to visit. Upon completing this process, the patient is directed to the payment points. The payment points are spread across the hospital facility for the ease and convenience of patients. The account officers uses the PID to access the patient's transactions. Upon doing this, the process is completed by issuing a receipt to the patient. Now, a patient can also deposit to make her processes across the hospital a lot easier and faster. The patient, when done with this point, goes to the clinic she intends to visit and goes straight to the nursing station. At the nursing station, again she hands a card over to the nursing officer, who checks for her details using her PID. When found, the patient's vital signs are taken. Her temperature, her blood pressure, her pulse rate, etc. are all taken. When this is completed, the nurse imputes these values into the system and saves. When she saves, it means the doctors can access these details from any point in the hospital. The patient is then directed to the clinics where she sees a doctor. Of course, she would need to hand over her card again to the doctor to use her PID to access her information. The doctor, of course, would carry out procedures like lab requests, make pharmacy orders, radiology investigations, etc. It is also a point of conversation between the patient and the doctor. When the doctor is through with this process, he sends the patient to the lab. At the lab, the patient hands her ID to the receptionist. The receptionist checks through to find all the lab requests that have been made for the patient. The patient again is then directed to the phlebotomist, that is the MLS officer who handles blood samples. At the phlebotomist, the patient's samples are taken cautiously, kindly, and nicely, as you can see on the screen. She's then directed to the dispensary, the pharmacy dispensary. At the pharmacy dispensary, she's welcomed by the pharmacist. She's directed to sit, and then her card is requested for. With this card, her pharmacy orders are processed and her drugs are issued to her. This is the ABC process of healthcare in F.M.C. Keffi.